Very concerning news. All right, Jeff, thanks a lot. We continue our team coverage of the flu and RSV with Michelle Nixon. Michelle, you found out it's not just our hospitals staying busy, but places like pharmacies, urgent cares, also seeing people of all ages lining up to get treated for these illnesses.
You bet, Chris. Urgent cares, just like hospitals, are seeing and testing an influx of patients for flu, RSV, and COVID. And while the ages of those patients run the gamut, when do you know when a child or a loved one needs emergency medical attention? It's that time of year. Flu season, but this year the flu and other respiratory illnesses are back with a vengeance, hitting earlier than normal and in some cases far more serious. Holly Zellers is a physician's assistant at Lakewood Urgent Care.
That's the majority of what we've been seeing the last few weeks, respiratory, cold, like symptoms, people coming in just saying they're ill with cough and nasal congestion and a productive cough, body aches, fevers, chills.
What's so different this year than the past 2 years? Not as many people are wearing masks or social distancing. And while people of all ages are contracting the flu, if anyone is struggling to breathe, get them to an emergency room immediately.
Tylenol, Motrin, but if they're struggling for breath, if they're coughing and they can't catch their breath, if they have that croupy cough that the 2-year-old sect type tends to get, then I would bring them in to be evaluated. Or high fevers, sustained high fevers.
Zeller says keep in mind the holiday gatherings are coming, and she urges everyone to use the same precautions as when COVID was at its worst.
Frequent hand washing, masks if you're out in big populations, don't shake hands, and normal hand hygiene, being smart.
A flu shot and COVID vaccine are the best advice.
Will it prevent you from getting it? Not always, but it'll prevent you from getting serious disease, which is what's important.
Now, Lakewood's Urgent Care tells me they are temporarily out of the rapid test, but they have what's called a combination test that tests for the flu, RSV, and COVID. They normally can have that back from a lab in 2 days. Reporting live in Cleveland, Michelle Nix, 19 News.